Okay, so imagine this. You're a surgeon and you have to get to a brain tumor.
Uh,
But instead of going through the skull, you go through the eye socket.
wow.
It sounds impossible, right?
It does.
But that's exactly what we're going to be diving into today.
I'm ready.
A revolutionary surgery that's totally changing brain tumor treatment.
Yeah.
And our source material for this is a really amazing article about the first UK patient to undergo this procedure.
It really shows just how far we've come with surgical techniques.
Right.
I mean, not that long ago, a tumor in this location would have been basically untouchable.
Yeah, and that's where our patient Ruvimbo Kaviya comes in.
Okay.
She's a mother of 3 and a nurse from Leeds.
Mhm.
And she was having these just awful headaches, just excruciating.
Oh, wow.
And it turns out that the cause of these headaches was a meningioma, which is a type of brain tumor.
Okay.
And hers was nestled in a really, really tricky spot called cavernous sinus,
Oh, I see.
which sits right behind the eyes and underneath the brain.
Yeah, that location is what makes this case so complex.
Right.
You know, if you think about like the traditional way to do brain surgery,
Yeah.
to get to a tumor in this location, surgeons would have to remove part of the skull
Oh, wow.
and actually move the brain itself to get to the tumor.
So that just sounds incredibly risky.
Yeah.
What kind of dangers are we talking about that?
Significant ones, unfortunately.
Yeah.
Seizures, all sorts of other neurological issues.
Right.
For Miss Kaviya, it was just too risky, and initially surgery wasn't even an option.
So how did they go from inoperable to actually performing the surgery?
Well, this is where the eye socket comes in.
Okay.
Surgeons at Leeds teaching hospitals were the first in the UK to do this procedure.
Wow.
It's called an endoscopic trans-orbital approach.
Okay.
It's basically keyhole surgery, but through the eye.
I'm trying to wrap my head around that. Are they really going through the eye itself?
Not exactly.
Okay.
They make a small cut near the eye
Mm-hmm.
and use a tiny camera called an endoscope to gently move the eye aside.
Okay.
So it gives them access to the back of the eye socket.
Okay, so they're using the eye as a pathway, but not going through it directly.
Exactly.
Okay, that makes a little bit more sense.
Yeah.
So what happens next?
So next they remove a small piece of bone at the back of the eye socket
Okay.
so they can get to the tumor.
Mm-hmm.
And then through that tiny incision, they insert a flexible tube and remove the tumor.
Wow.
And the craziest part is the only sign of the surgery is a tiny scar near the eye.
Wow, to think that they can remove a brain tumor through such a small incision is just mind-blowing.
It's amazing.
But I imagine this takes a ton of planning,
Oh, yeah.
expertise.
Absolutely. This wasn't something they just jumped into.
Right.
The surgical team planned everything out meticulously.
Okay.
They used 3D models of Miss Kaviya's head to map out every single step.
Wow.
They even practiced the procedure on cadavers.
So they took every precaution to make sure that it was a success?
They did, and it paid off.
Yeah.
The surgery only took 3 hours,
Wow.
and Miss Kaviya was walking around later that day.
That's incredible.
Yeah, it really shows how skilled the surgeons were
Right.
and how minimally invasive this approach is.
Mm.
And because they're not putting direct pressure on the brain,
Yeah.
the risk of things like seizures is way lower.
That's amazing.
Yeah,
But let's talk about Miss Kaviya for a second.
sure.
What must it have been like for her to go through a pioneering surgery like that?
Well, her headaches were so bad that she was willing to try anything for relief.
Wow.
She said, all I needed was for it to be removed.
That's some serious courage.
It is.
Especially knowing that it was the first time this was being done in the UK.
Yeah.
Did she have any second thoughts?
Surprisingly, she said she didn't hesitate at all.
Wow.
The pain was just too much.
Okay.
She knew this was her best chance, and she took it.
Wow.
Even her family, who were a little skeptical at first,
Yeah.
ended up supporting her decision.
That's great.
She told them, there's a first time to everything. This might be the best chance for me to have it.
Yeah.
And it was.
And it was. So she had the surgery, she recovered, and now?
Now, after about 3 months of recovery, she's back at work as a stroke rehabilitation nurse.
Oh, wow.
Yeah,
It's really amazing how she's come full circle,
it is.
using her own experience to help others recover.
Yeah.
Speaking of which, I think we should talk about meningiomas themselves a little bit.
Okay.
So our listeners understand what we're dealing with.
Well, sure.
What are they?
So meningiomas are tumors that grow in the layers of tissue that surround the brain and spinal cord.
Okay.
And in England, they account for about 27% of all brain tumor diagnoses.
Wow. That's a lot.
It is.
Are they usually cancers?
Actually, they're the most common type of benign brain tumor in the UK.
Oh, okay. So benign meaning non-cancerous.
Exactly.
Okay, well, that's somewhat reassuring, I guess. But I imagine even a benign tumor in such a sensitive area can still cause some serious problems.
Oh, absolutely.
Yeah.
Even though they tend to be slow growing,
Right.
they can still press on the brain
Yeah.
and cause all sorts of symptoms depending on their size and location.
Like the excruciating headaches Miss Kaviya was having.
Exactly. Other symptoms can include seizures, weakness in the limbs, problems with vision, and even hearing loss.
So it seems like early detection and treatment are really crucial for these types of tumors.
I couldn't agree more.
Yeah.
And cases like Miss Kaviya's really show us how important it is to keep developing less invasive and more effective treatment options.
It's truly remarkable how this new surgical approach is changing things.
It is.
What's even more fascinating is how it opens up all these possibilities for treating other conditions that we thought were inoperable before.
That's where things get really interesting.
Yeah.
But I think we should save that discussion for part 2 of this deep dive.
Okay, sounds good.
It deserves its own exploration.
All right.
It's cases like Miss Kaviya's, that really give us a glimpse into the future of surgery.
Right.
I mean, if we can take out a brain tumor through the eye socket,
Yeah.
what else could be possible?
It really does make you wonder what else is out there. It's not just about this one specific surgery.
Right.
It's like a whole new way of thinking about how we do surgery.
Absolutely. The endoscopic trans-orbitals approach,
Yeah.
it really represents this shift
Okay.
towards these minimally invasive techniques. And that has huge implications.
So it's not just about what they did, but how they did it.
Exactly.
Right.
Think back to what we were saying about traditional brain surgery.
Yeah.
To even get to a tumor in such a sensitive area,
Right.
they often have to remove a big chunk of the skull
Wow.
and even manipulate the brain itself.
And that, like we said, has a lot of risks.
Yeah.
A lot more room for things to go wrong.
Higher chance of complications, damage to tissue.
Right, exactly.
But now compare that to the endoscopic transorbital approach.
Yeah.
They're taking a much more refined and targeted route.
It's almost like using a scalpel instead of a sledgehammer.
That's a great way to put it.
Yeah.
It's all about minimizing the disruption
Yeah.
to the surrounding structures.
So less damage, basically.
Exactly. Precision is key.
So that means fewer complications
Yes.
and faster recovery times.
Faster recovery times, exactly.
And Miss Kaviya walking around that same day is proof.
Exactly.
Yeah.
This approach is about getting rid of the problem, but minimizing the trauma to the body as a whole.
So it's not just about getting the tumor out.
Right.
It's about preserving the patient's quality of life.
Exactly. It's about their well-being. It's holistic.
Yeah.
It's beyond just the immediate goal.
Right.
And we can't forget about technology.
Yeah.
Remember the 3D models
Right.
and the practicing on cadavers?
Right.
Those are huge.
It's amazing how much technology allows these surgeons to really plan out and practice.
It is. It's like a dress rehearsal
Yeah.
before the main event.
That's a great way to put it.
So that level of preparation allows them to anticipate any problems,
Okay.
fine-tune their approach, and ultimately do the surgery with more precision and confidence.
Right. And that practice on cadavers,
Yeah.
that must be invaluable.
It's huge.
Yeah.
It gives them a safe space to practice
Yeah.
and really refine their technique.
Okay, so we've talked about the what and the how of this surgery, but
Yeah.
what about the so what?
That's the question, isn't it?
What does all of this mean in the grand scheme of things?
Well, this procedure, it opens up so many possibilities.
Okay.
We could use this approach
Yeah.
to treat other things that used to be considered too risky
Okay.
or just too hard to get to.
So it's not just about brain tumors then.
No, it's about expanding our options
Right.
for a whole range of conditions.
So like what?
Well, this minimally invasive approach could be used for other neurological issues,
Okay.
vascular abnormalities, even certain skull-based tumors.
It's like this whole new frontier
That's a great way to put it.
of surgical possibility.
It could totally revolutionize how we approach these complex conditions.
It's really amazing to think about how many lives this could affect.
It really underscores how crucial ongoing research and innovation are.
Absolutely.
Who knows what other amazing breakthroughs are just around the corner.
This has been amazing. We've explored this new technique.
Yeah.
We've talked about the potential to apply it to other things.
Huh.
And we've even touched on the technology that drives it.
And we've seen how the human spirit,
Right.
like Miss Kaviya,
Yeah.
plays such an important role in pushing those boundaries.
Absolutely. And speaking of Missy Kaviya, I think it's worth spending a little bit more time thinking about her strength
Okay.
throughout this whole process.
Mm.
I mean, she was faced with this life-altering diagnosis,
Yeah.
but she didn't just give up.
Right.
She actively looked for solutions,
Right.
even if it meant being the first one to try this new surgery. I mean, what gives someone that type of resilience?
Yeah, it's such a good question.
Yeah.
And I think it's a mix of things.
So it's not just about being tough.
No,
It's a bunch of things that all come together.
it is. It's genetics, it's life experience,
Mm.
it's the people you have around you, it's your values.
Right. And even just thinking about Miss Kaviya's recovery, I mean, she was walking around that same day
Right.
and back at work in 3 months.
That's right.
Yeah.
And it shows
Yeah.
just how minimally invasive this procedure is.
Yeah.
But it also shows her mindset
Right.
and her will to get better.
That's so important. I think that's a big takeaway
Yeah.
for anyone dealing with a health issue.
Mm-hmm.
You know, your mindset is so important.
Your mind is powerful.
Yeah.
And your determination to heal.
The medical advancements are amazing.
They are.
You know, the surgery is incredible,
Yeah,
but the patient also has to be strong.
absolutely. They both play a part.
This has been such an amazing journey.
It has.
I mean, we learned so much about this surgery.
We did.
Its potential, the technology, and the human element of all of this.
That human element is so important.
Miss Kaviya is just incredible.
She is.
It makes me feel so optimistic
Yeah.
about the future of medicine.
Me too.
You know, if we
Yeah.
can remove a brain tumor through the eye,
I know.
what can't we do?
Exactly.
Lola?
And it's because of the research and the innovation.
Yeah.
And people like Miss Kaviya.
Absolutely.
Mm.
To all our listeners out there, I
Yeah.
hope this inspires you to stay curious about the world of medicine.
It's an exciting time.
And like Miss Kaviya shows us,
Yeah.
even when things seem impossible,
Mm.
there's always hope.
Always.
Keep fighting.